Hello, everybody. Hello, hello. Who's here? Hello, Smexy Apples. Hello, Kapitan Toblerone. Hello, Chadomatsu. 144 piece tree. Hello, Lemon Teas. Hello, hello. Hello, Benji Boy Jr. I'm just here because Twitch recommended me. Oh, really? Oh, really? Twitch recommended me already? Didn't expect that to happen. Welcome to my stream then. You're just in time. I'm gonna do a medical education stream actually. I was supposed to start at 8, but then I'm sorry I'm late. I was supposed to have this stream like an hour and 30 minutes ago, but then I had a surgery to do. I had a surgery to do, and I didn't expect the surgery to start late and end late. Oh well, I'm sorry about the delay, guys. Hunter Okami, hello. Jolly Beast, hello, hello. Education about some ass. Elevate Twister, hello. I highly suspect that when Shiri does her laparotomy, she does it with the under her face. It won't be seen because I'm wearing PPE. Okay, let me set up this thing. Now I want to know if my ass is safe. Okay, yeah, before I start, I just want to mention that Benji Boy Jr., thank you for following. Thank you, thank you. I hope you enjoy my content. I do monthly and medical education streams for those who are new here. Yeah, I do educational streams every month. Last month I wasn't able to have any because of I was too busy. I was way too busy for last month. And yeah, is my ass safe? If your ass doesn't have any disease, you're safe. Don't worry about it. Yeah, before I start again, I'm still doing the donation drive, so for Malvin. For those who don't know about Malvin, let me go through it for a while before I start. Let me look for Malvin. Hold on, guys. I'll just run through this quickly. Let's see. Guys. Okay, this one would be it. Okay. Okay, before yeah, I'll just run through this really quickly, guys. Donation drive, yeah, it's still ongoing. The last day of this donation drive is on March 19, which is the last, yeah, the last stream of the week. Oh, no, that's not the last stream of the week. But anyway, Malvin Rivera, he is the owner of a local anime shirt shop called Tishatsu. He's been asking for help since like last week for his parents. I mean, his whole family, him and his whole family got COVID. So, the one who got it worse was his mother, and his mother's admitted at a hospital. She's slowly recovering now because of everyone's help. We've been trying to help her. He just needed help for the bills and for getting a medication, remdesivir, which is the antiviral for COVID. So, yeah, he just needs help with the bills. So far his mom's doing better now. So yeah, if you can help out, you can donate to Gcash if you're from the Philippines. So the link is over there, right there. You can see the not the link, the details on the middle of my overlay. Malvin Rivera, and then the number's there, and you can just donate how much. If you're not from the Philippines or if you don't have Gcash, you can donate through my Streamlabs. All the donations through Streamlabs will go straight to Malvin on March 19. So, yeah, that's all. That's all. Alright, let's go straight to the lecture. Hold on. Okay. Hello, Rion. Hello, Gangster God. Oh my god, there's a lot of people here. Wait, okay, let me just fix this. Let me fix my PowerPoint. The reason why it took a while ago is because wait. When I opened up my PowerPoint, When I open up my PowerPoint, some pictures are missing. I don't know why. Anyway, let me fix this. Hold on. Why is this like this? Wait. What? Okay, why is this like this? Okay, there we go. Okay, I think that's good. Alright. So, okay. I am here to learn. But review when? You want me to review your butts? Top 10 video game. But, you know, butt is different from the anus, Rion. The butt is like the gluteus maximus. Or the fat that comes with it. But we're talking about the anus right now. I always wanted to see a lecture with Twitch chat. What did I expect? Alright, anyway, let's go. Let's start this. This is really quick. So, after the lecture should take about an hour. And then after that, there's no surgeon simulator tonight. So we can just, I can probably entertain you guys for like a few minutes or like 30 minutes or so after. Alright, let's go! Okay, guys. We're gonna talk about the anus tonight. And here is a Kraken, the erotic saint. Erotic saint, thank you for the follow. I hope you enjoy this this educational lecture about the anus. About the anus. This is gonna be Alright, guys. So we're gonna talk about the anus. Now this is an actual photo of Sir Wheatbread from the back, from his behind. You want to see Bread's anus? Oh my god, that sounds so bad. This is an actual photo of Sir Wheatbread's behind. Derail Story, thank you for the follow. I thought it's a lecture about Uranus. I'm not an astrologist, Raven. I am a doctor. I am a human doctor. Okay, guys. Alright, so this is what you see here is some nice fluffy buns of Sir Wheatbread. But the anus is not the butt, okay? The butt would be this entire thing, but the anus is just a hole. A hole. Thank you for the head pats. Alright, let's go. Wait, how do I go? Okay. First we'll go to the anatomy of the anus, okay? So this is a very artistic. This is the photo we see in med school, like every day. So you don't need to memorize all these labels here. All you gotta know is that this is the anus. This is a cut section of your butt. So this is the anus. This whole thing is the anus here. Up here is the rectum, okay? The rectum. Oh my god. Thank you for the hydrate, you guys. Alright. Every day. Yeah, in med school. In the anatomy class. Of course it's Netter. Yes, Netter. Netter. This right here, Netter. He has a book, and this is the book we study in med school. So, this is the anus, okay? Up here is the rectum, which is connected to the colon or the large intestine. The end of the colon is the anus. This is where your poop comes out. So, anatomy. Let's go basic, okay? So, you just need to know that this thing here with the ridges is called the dentate line. This is very important in differentiating hemorrhoids, because there's different kinds of hemorrhoids. And the muscles here, these over here, this red meaty stuff, these are the muscles. Okay? The ones here in the inner part is called the internal sphincter muscle. And outside is the external sphincter muscle. So this is the one that controls your defecation or your pooping. So the internal one is involuntary. The external is the one you control. So if you contract your butt, yeah, you're contracting this so that you don't poop. Shintoki, thank you for following. Thank you for following. Yes, this is the side view. It's like a no, it's not cross-section, sagittal view. Like if you cut yourself lengthwise. This is how it looks. Alright. Am I late for the anus stream? I just started, Brian. I just started actually. Okay, so yeah, this blue stuff here, these are blood vessels. Those are basically the hemorrhoids. I'll talk about these later on. But that's all you guys need to know in a basic sense. You don't need to know if you want to get really, really detailed. Like this is called the dentate line, and then they have little crypts. Those are called the columns of Morgagni. You don't need to know that unless you're a doctor or a medical student. Okay, yeah. Hi, and cute model. Thank you, Shiro Luffy. Glunfell, thank you for following. The muscle that holds it all. Yeah, if there's a problem with any of these muscles, you'll have fecal incontinence, which is you can't control your pooping. Basically, your poop will just pour out of your butt, your anus. So yeah, the muscles are very important. Okay, you gotta make sure those muscles don't get damaged at all. All right, the yellow stuff you see here are the fat. These are the fat. The subcutaneous tissue, in other words, in medical terms, the subcutaneous tissue or the adipose tissue, those are fat. Okay, next slide. No, what is the purpose of the anus? I'm pretty sure you all know the purpose of the anus, right? What if I'm weak, baby? I'm sure you all know the purpose of the anus, which is basically to just expel your your poop, your caca, your shit, you know. Self-explanatory. Self-explanatory. I don't think I need to I don't think I need to explain this or pass gas. There's another one to pass gas. There's no Hello, Ange Small. Yeah. It's for shitting in another thing. For passing gas, Ray Winter. This isn't unsay so. This is very say so. This is a very educational stream. I am not gonna go any unsay so or what. I don't know with you naughty people. Naughty viewers. Naughty viewers. Yes, it's a stock image, okay? I had to rush this a while ago when I opened the PowerPoint a while ago. Like all I had like some of my images disappeared. I'm like, I had to like quickly search on the internet. Leonair, hello, thank you for the hydrate. Wait, let me hydrate. Alright, okay, next slide, guys. We're done looking at the poop now. Okay, so what if you have a problem in your anus? Let's say most problems in the anus. Most patients would complain of anal pain or anal mass or a discharge coming out of their anus. You know, that's a common ones, but most common is or even bleeding from the anus. Hello, Kitty Andre. Hello, Andre. So usually we have to there's a certain examination which I'm pretty sure if you had an annual physical exam, I'm pretty sure you're familiar with this examination, okay? The first examination is the digital rectal exam, okay? This is very important. I had to censor the penis and the I had to censor the penis, okay? Just in case Twitch comes after me. So, as usual, we have the trusty Sir Wheatbread to censor stuff for me. So, we have the digital rectal exam, or the DRE, which is basically when when a doctor inserts the finger into your anus and has to feel inside. So, it's a... Why is Brett a censor? He's been a censor since my breast stream. Okay? He's a staple censor now. So everything that needs censor, Sir Wheatbread is the censor. It's like it's automatic. It's a norm now. It's a norm. It's a norm. I once had a patient who stuck a bottle up there. Yeah. I've had some of that. Someone had a Gatorade bottle. Someone had a Gatorade bottle, a test tube bottle, a toothbrush, and what else did he have in there before? What else did he? I had another one who put a deodorant, a deodorant spray in there. I don't even know why these people do that. Anyway, yeah. Oh, this happened to me. Oh, Nawaru, the unfortunate one, had to undergo a digital rectal exam. But this is an important exam actually. If you have complaints about the anus, say you doctors will really have to do this. It's a little embarrassing probably to the lay people, but you know it has to be done because what the doctor does is they use a lubricant and then they place it on the finger and then and then they they put it inside your anus, and then they just feel. They can feel your prostate from there, by the way. That's why there's an image of the prostate here. They can assess if your prostate is large. They can also feel if there's any masses or anything, and to check if there's blood. So yeah, this is a very important examination. Is it really dangerous if you're constipated and you're gonna what? Erect a large poop, the one that's so hard to erect. I mean, what? I didn't understand your question. You mean like if the poop is too hard? We'll talk about that. I'm gonna talk about that later. I'm gonna talk about that. I like to give myself digital rectal exams. May you Twister, get your kink off of my stream. Get your kinks off of my stream. It was cold. I've never, okay, personally, I've never had this done to me because I refuse it. I don't feel like there's anything wrong up my anus, so I refuse this. I tingled about. Having bread there is so weird. It's normal. It's normal. You'll get used to bread being there. What if I farted in the middle of the examination? The doctor will ignore it if you did. I forgot the term. I mean the one that's so hard to release. What? Constipated poop. A hard poop. I don't know. Okay. I'm gonna get traumatized by all your questions. Alright, let's go. Okay, so after digital rectal exam, another common one, it's a procedure done in the operating room. Usually done in the operating room anyway. And it's called a proctosigmoidoscopy or an anoscopy. Oni-chans! Thank you for following. So, a proctosigmoidoscopy is basically this thing right here. I don't. Do I have to explain what what they do with what they do with this? An anoscope is shorter because you only want to check like 10 centimeters from the anal verge, from the anus. And if you want to check further, you get the bigger ones, the longer ones. Yes, anoscopy. 25 centimeters of glory. Basically, yeah. Okay, okay. Mia Twister, anal dildo. Oh my god, be careful what you guys are saying on the chat, okay? I don't want to get banned here. Yeah, so anyway, so you know, a digital rectal exam, you don't have visualization, and you can only feel with your finger, and my finger is only like 7 centimeters long, or 6 centimeters long. You know, if some doctors would have short fingers and they can't really feel that far up, so the next option is to do a scope or a anoscopy or proctosigmoidoscopy. So what they do is they it looks like this. This is the scope, and then this right here is the handle that has a light source. This thing is like an obturator. They put it in here, like this right here, so that when it enters your anus, it's smooth. You have to put gel. You have to put gel, and then you insert this into the anus up to wherever. You can insert up to 25 cm. And then after that, once this is inserted, you remove this one right here, the obturator, and then you can look through here. There's a glass window here. That's where you look, and you can see the inside. You can see the inside of the rectum and the anus. All right. Hello, hello, Yume. Obori. Oh yeah, the Ube girl. Hello, Ube girl. It's okay, you're not that late, to be honest. I just started. Anus good. Kiyu, I keep forgetting your nickname is Kiyu. Every time I see you, Kiyu, I would say Ube girl. I would refer to you as Ube girl. Alright. Once it's inside, it gets cold. But wait, guys, don't worry. When this is done, there's usually anesthesia, so you don't really feel it. There's usually anesthesia, like, spinal anesthesia. Most of the time, the once I assisted this, they had a spinal anesthesia, so their lower body gets numb, so they don't feel this. They don't really feel this. So yeah. It's easy to remember. I was so curious about this. Hi. Doc, I wanna feel it. You know, oh my god. You won't be able to feel it because most likely they'll probably sedate you. And you won't be able to feel it anyway. All right, we're done with this. We're done with this. Let's move on. Let's move on, guys. Let's see. Yeah, let's move on. All right, diseases. Diseases of the anus. I'm gonna talk about the most common diseases. Actually, yeah, the most common ones plus cancer. The cancer's the last one because cancer's the most complicated one. A whole different meaning of beauty inside. Hello, show. Welcome to my stream. Alright, diseases. Most common complaints that patients have about the anus would be, as I said a while ago, anal pain, bleeding, uh, discharge, like pus coming out, or even mass. They feel a mass in their anus. So yeah. Most common is pain, pain and bleeding. So let's go to the next. The first disease. The first disease is a little gross. Okay, I'm gonna go for the gross ones. Okay, anal warts. Anal warts is a really gross. It's a gross disease. I swear, it's not pretty to look at. It's worse than hemorrhoids. This thing is, it's bad. It's very bad. Okay. All right. I For the bread is the censor. Yes, bread is always the censor. He has been the censor ever since I had my breast stream. Okay. Anal warts is usually caused by HPV or human papilloma virus. Okay. Bread is barely large enough to cover the scrotum. Well, this picture has a guy with a large scrotum. Okay. Okay. So, I couldn't find a really, I had to look in Google for a cartoony photo of anal warts, and I couldn't find any. And if you type in anal warts and look at images, it's not pretty. If you want to give yourself nightmares or traumatize yourself, you can go do that. Just Google anal warts and just search anal warts on Google. They look like the actual appearance. They look like fleshy cauliflowers sprouting out of your anus, basically. So, I don't know. I decided to put a cauliflower of bread here to represent the warts that are on the anus. So, like I said, it's usually caused by HPV or human papilloma virus, which is an STI or a sexually transmitted infection, or commonly known as STD for you guys. Okay. STD. Usually men have this. And I'm pretty sure you guys know how men get this. I'm sure you guys know how you could contract the STD. I don't need to go into detail about that, or Twitch might ban me. Okay. Yeah, men. Men. Some women get it, but it's a lot more common in men. Yes, it's a lot more common in men. What? I don't Google anal. At least not. Yeah, it's. I'm pretty sure you guys can. You guys can guess why it's more common in men, okay? But don't worry, even women can get this. It would sometimes they can get it also, but it's more common in men. They can get it in their anus. They can get it in their vagina. They can get it. They can get it anywhere in that area. Yeah. Depends if you're into that. Hello, Atelier Mizu. Don't kink shame. Doc, what are you thinking about? What do you mean, what am I thinking about? I'm thinking about anus right now. Because I'm discussing about anus. It's common in men. They can get in the vagina. No, I mean the females. Alright, let's go. Let's skip the warts, okay? We're done looking at the bread warts, okay? We're done looking at this. Alright, treatment. We can go conservative, okay? We can go conservative treatment. We have a topical cream, so one of them is imiquimod. There are other creams, you just apply it. You can just apply it, but then if it can't be treated by creams, you gotta go surgical. You gotta go surgical, you guys, which is usually we do electrocautery, but there's other ways. An electrocautery is this. It's like a little pen. It's like a little pen. You just burn the wart. You basically burn the wart. So yeah, they would if you've ever been in an operating room before and you've seen a cautery, they would stick this pad here, and then there's like a machine, and then there's like a pen connected, and then you'll hear like a beeping sound when the doctor uses it. He's basically burning something on you. They burn the warts. There's also laser therapy, but I have not seen that. This is the usual one I see. So yeah, electrocautery. Okay. Uh all right. Ah, yes, electrolytes. I gave up my pooping ability. What? Do you guys still use liquid nitro for? Yeah, I think they still prescribe that, but usually I see electrocautery. Usually I see electrocautery. Just remove the damn thing. Remove the damn thing right away and just burn it. Burn it to hell. Toasty crispy. It'll smell like steak. Liquid nitro. Yeah, yeah. Usually we just cauterize it. Popcorn. Yes. Speak English, please. And if you can see, this is an English Filipino stream. Mostly English. Please English. Okay. It might smell like burnt shit. I guess not really. It doesn't really smell like burnt shit. Usually before you do anal surgeries, you do a bowel prep or make sure they empty their bowels first before you do this. Riansvel, hello, hello. Oops. Okay. Yeah, next I accidentally pressed the space bar. Hello, Ransviel. Welcome to my stream. Okay, next one is hemorrhoids. This one's very common. This is a very common disease. Okay, so usually as cyberpunk, this is usually as the patient would complain of pain or bleeding or mass. So usually it would be a cycle of those three, but yeah, usually it's mass. They would say may bukol sa puwet or may nakakapahong bukol sa puwet ko or I feel a mass in my butt up in my anus. So we got two types of hemorrhoids. We got two types of hemorrhoids, guys, okay? The two types of one is external hemorrhoids and the other is internal hemorrhoids, okay? So yeah, like I said before in the anatomy of the anus, you have this dentate line here. External hemorrhoids is below the dentate line, so it's here, as you can see. This one is the painful one. This is painful. Like if you touch it, it hurts. It'll be swollen and everything. It'll swell up, and then when it swells up, it's painful. So that's external hemorrhoids. Hello, Levi Ackerman. Welcome to my stream. Internal hemorrhoids is the one that's above the dentate line, so here. And usually this is painless. Well, usually, okay? There are times when it becomes painful because I will show you later. Alright? I'm currently in pain in my leg. What? Why? Did you sit on it? Okay. Painless, yeah. It'll possibly feel like when you get them fire shit. Well, yeah, usually the patients would complain, like they would feel the pain when they defecate. Of course, because when your poop passes through, it's gonna like touch the hemorrhoids. Even when sitting down, sometimes they would have external hemorrhoids. When they sit down, they feel it. It's a blood vessel, like engorged blood vessels. So these bleed. These commonly bleed. Okay. All right. So next. Okay, internal. Like I said. Oops. For internal hemorrhoids, we got four. They grade this. Okay, we regrade this. You might, if you ever have hemorrhoids, and then they would tell you, oh, you have grade 3 hemorrhoids or grade whatever hemorrhoids. I'll explain each one. We got the first grade or grade 1. Basically, the hemorrhoid, it's only for internal, okay, not for external. The hemorrhoid is just swollen. It's just there, swollen. It's usually painless. Okay? And grade 2 is it's swollen. It's swollen and then it goes out. It sometimes sticks out of your butt. It sticks out of the anus, but then after a while it goes back inside by itself. It spontaneously goes back. That's grade 2. Now, if you have a grade 3, swollen hemorrhoid, internal hemorrhoids, it goes out, but it can only go back inside if the patient puts it back inside. So sometimes I would get patients who come and say they have hemorrhoids, but they are able to put it back inside. It comes out, but they're able to put it back. That would be a grade 3. Fourth degree, they it comes out of the anus and they're unable to put it back. It stays there. It stays there. Sometimes these two are the painful ones. Because if a hemorrhoid sticks out of your anus, and you know how the anus is, it's kind of tight, so it squeezes that, it can get more swollen, uh, and what do you call this? Inflamed, and it becomes painful. It becomes painful. It can become painful. All right. My leg has a bullet wound through the thigh, which is already treated, but my foot is like numb and burning and cramping. It's probably a nerve injury or something. Can I pull it out? Pull what out? Pull what out? Never pop a hemorrhoid. Just painful to look at. Yeah, actually, hemorrhoids is pretty painful. I mean, just interviewing the patients, I could tell that it's painful. All right, next. So treatment. First line of treatment for hemorrhoids. You don't usually do surgery unless it's a grade 4. Unless it's a grade 4 internal hemorrhoid or a grade 3 that is really big. Unless it's a really huge hemorrhoid. But if it's small or easily put back, you can easily put it back in. You don't need a surgery for that yet. So usually the doctor would advise you to change your diet or eat high fiber diet. So vegetables, green leafy vegetables, and all that. I don't know why there's banana here. I just googled high fiber diet and then this came up. But there's a banana. Banana makes your poop hard. I wouldn't advise eating banana. Psyllium fiber, yeah, that's a good one. Psyllium fiber helps, not hurts. Psyllium fiber helps. So you need a high fiber diet and you need to drink a lot of water. The reason for this is you want to make your stool or your poop softer and not hard. So yeah. Yeah, softer, not hard, because the cause of hemorrhoids is when you put a lot of pressure in your lower abdomen or in your anus. That's actually the cause of hemorrhoids, like heavy lifting, forcing your poop to come out when it doesn't want to come out. That's why when you have a hard stool or hard poop. What else? Pregnancy is one also because it applies pressure on the lower part of your abdomen. Or even large prostate, like the older men when they have a large prostate, they try to pee and they have a hard time peeing, so they try to push it out, and that's what happens. I can't believe I'm eating dinner while watching this. This is educational anyway. Another thing is lactulose medicine or pain medication here. Pain medication for the pain. Sometimes they'll give you lactulose or what do you call this? Mineral oil or whatever oil to make your poop softer. Laxative. There we go. That's the term I'm looking for. They'll give you a laxative. And this is just an image of hot sit. We call it a hot sits bath or a warm sits bath. So if you have anal pain, all you gotta do is put warm water in a little what do you call this, a basin, and then just dip your butt in there for like 15 minutes or 30 minutes, like 2 times a day. It feels good in the butt. It feels good in the anus. We actually instruct this to the patients. You have to yeah, it has to be warm water, and then you just dip your butt in there. It's called a warm or a hot sits bath. So yeah. Do you recommend Katialis? What's Katialis? Wait, what is Katialis? I don't know what Katialis is. Katialis? Let me look at that. Wait, what? What is Katialis? Katialis. Ah, Katialis cream. Uh, Katialis cream. Wait, no. Katialis cream. I'm looking at it right now. And this is for like, yeah, this is for external hemorrhoids. It's like for relief of external hemorrhoids. But I don't prescribe this though. I don't prescribe this. I usually prescribe pain medications and Daflon. But there's some who prescribe creams on the external hemorrhoid. The one I usually hear is Factu. The one I usually hear is Factu, not Katialis. Katialis. Ah, Katialis. Katialis pala. I was like Katialis. Katialis. Oh my god, Katialis pala yun. Diyos ko. Okay, I didn't know that. But I looked at it. I looked at it and it says it's for only for external hemorrhoids, not for internal. See, I have never heard of the Katialis before. This is why. I've never heard of that. I don't even prescribe that. I prescribe I prescribe I prescribe something else. I only know Factu. Factu cream. Oh my god. Oh my god. Okay. Alright, let's go to the next slide. We go to the next slide. Okay. Now, if conservative treatment doesn't work, we got surgical treatment. Can you treat it with lidocaine? Lidocaine is an anesthetic. That's a local anesthesia. The next treatment is hemorrhoidectomy or the removal of the hemorrhoids. Okay, thank you for the hydrate. Actually, yeah, I need to hydrate right now. Okay. So, the hemorrhoidectomy. There's a lot of different ways to do a hemorrhoidectomy, but I usually only see the open hemorrhoidectomy and the closed hemorrhoidectomy. There's different kinds of different ways of removing hemorrhoids, but yeah, these are the only ones I've seen. Just surgically removing the hemorrhoid. They put you on anesthesia, spinal anesthesia, so you can't feel your lower body, and then wait, and then they put this. This is called an anal retractor. They put this inside your butt, and they remove the hemorrhoid. They remove the hemorrhoid, and they can either leave it open, which is the open hemorrhoidectomy, and they just burn this part so it doesn't bleed, or they can close it, which is a closed hemorrhoidectomy. So those are the ones I've seen. Vicks treatment best. Oh my god! Imagine putting Vicks on your butt. That's gonna be really minty and I don't know. It sounds painful. On the butt. I'm late. Yeah, but hello, Flappy Yuri. Shoot, might as well remove your butt. This reminds me of Pepe Herrera in the Consulta MD commercial. Okay. Alright, cooling effect on the butt. I feel like it's gonna be a burning rather than cooling the butt, you know? Flaming anus, yeah, about a flaming anus. Alright, next. Okay, the next disease is perianal abscess. Okay. Perianal perianal, which is around the anal area. Abscess means there is pus. So basically, this is pus in the anal area. The cause of this is, there's like glands here in the anus that get infected. And when they get infected, you know how an infection forms pus, right? So you get an anal abscess. You get an anal abscess, alright? So, yeah, the treatment for this if is usually surgery. Antibiotics also, but there's usually surgery. Okay. All right. Wait, hold on. So, surgery of an perianal abscess is an incision and drainage. Okay, so what we do is it's usually under spinal anesthesia, but you can do it under local anesthesia. Lidocaine is the usual local anesthesia we use. So you just put the anesthesia and then you just cut it. You slice it and drain the pus. You just slice it and drain the pus. Okay. Basically, yeah, the scalpel is ready. That's what it is. That's what it is. Okay, hold on. Wait, hold on, guys. Barbecue fart flare. What? Oh my god, okay. Scalpel is scary. Well, this is the kind of scalpel we usually use. There's actually a name for these blades. The sharp one is called a blade 11. Alright. Bread needs to cover the taint between the scrotum and the... Alright, next. Next. Wait, what? Okay, the next one is a fistula in ano. So a while ago you saw Tsukinichi, thank you for following. A while ago you saw the perianal abscess, so it's the same thing. What happens is if you have repeated abuse of, if you have a recurrent perianal abscess, it can turn into a fistula. And a fistula, a fistula in ano or an anal fistula is basically, there would be a tract from the anus or even the rectum going to going to outside, another track that is not within the anus. It like takes a detour. There's like a little detour. Flappy Yuri, thank you for following. I've been watching and I haven't followed. All right. Okay. So, you usually get this when you have repeated episodes of perianal abscess. Or actually, once you get perianal abscess, you have a chance of getting an anal fistula. So this kind of thing is treated with surgery also, okay? We have fistulotomy, fistulectomy. There's also one called the Seton technique, but I'll just talk about these because these are the common ones. So these blue lines here, these are the possible tracts of an anal fistula or a fistula in ano. So you gotta, it's surgical, the treatment, okay? You have to remove the fistula. Fistulotomy is when you open the fistula, when you open the tract and then you burn the tract itself. You don't really remove it, you just burn it. And then fistulectomy is when you remove the tract. And basically it, but they have the same purpose. I mean, you just have to get rid of the tract either way. Sundered, and thank you for following. Got operated with that 1 month recovery. Oh, okay. Fisting, what the hell? What are you guys talking about on my chat? What are you? you, you guys, yeah, you guys are the ones being unsafe so here. What is wrong with all of you? What is wrong with all of you? You guys are turning my educational stream into a kinky stream. Or, I don't know. You guys. What is wrong with all of you? Nana Basoda, thank you for following. Thank you so much. We are degenerates. Okay. Yeah. So, next. Next one is anal fissure. Hiroshi Kimeko, we are very say so. Whatever, you guys, whatever. Anal fissure. Anal fissure is basically a cut or a wound in the anus. This hurts. Okay, this is like having a tiny wound. This is like having a paper cut in your anus, and you know how paper cuts hurt. Imagine having that in your anus. Imagine having a 1 centimeter paper cut in your anus. This is it. This is it. This is quite a topic for my first exposure to Shiori. Yes. Welcome to my medical education stream. I usually stream games, but monthly I do medical education. All right. So you could get this. Usually you'd get this from hard poop, like forcing your poop out of your butt, and it's so hard that you scratch your anus, or you give your anus like a poop cut because it's not paper. It's not a paper cut. It's a poop cut. Basically sugat. Yes, basically sugat. All right. This hurts. A lot of patients complain about this. This hurts. Yeah. Treatment for this is usually you can do conservative. Again, same thing. You gotta soften the stools, make the poop soft, drink a lot of water, do a high fiber diet, take lactulose or laxatives, and do the hot sits bath where you dip your butt in warm water. Poop cut. Poop cut. Oh my god. Are anal fissures the one responsible for the red thing in the boob? What? The You confused Hiroshi. That was confusing. I'm like, what? What do you mean by the red thing in the poop? What do you mean red thing? The only red thing in the poop would be blood. But yeah, anal fissures can give you blood in your poop. Because it's a wound. Oh my god. You can Oh my god. Okay. Alright. Okay, we're gonna because of Hiroshi. I don't know why. I'm like wondering what would the anal fissure have to do with boobs? Stop using razor blades. Okay, anyway, we're moving on. Okay, let's move on. Treatment if conservative treatment doesn't work on anal fissures, you have surgical surgical treatment, which is a sphincterotomy or a lateral internal sphincterotomy. I have not assisted many of this, only a few. Only a few. So what they do is they look for the sphincter, the internal sphincter. They cut your skin open, look for the sphincter, and split it. That's basically the treatment. It helps loosen up the anus a little bit so that it's not too tight or causing pain. Oh my god, poop cut, poop cuts. Well, it's not paper cut; it's a poop cut. Okay. All right. So actually, anal fissures, I haven't seen much of this. Usually, I would see hemorrhoids or perianal abscess or what do you call this? Fistula and anal. Those are the usual ones I see. Anal fissure, not so much because anal fissures you can treat medically most of the time. I thought that the treatment for anal fissure is an antidepressant. What? What? Oh my god, you guys. Okay. All right, next slide. Let's go to the next slide. All right. Lastly, we have anal cancer. So, y'all know cancer. Cancer is shit. It's bad. So, people patients who complain of anal cancer, of course, they would feel a mass in their butt. They would complain of bleeding, like a lot of bleeding. It's not like the bleeding of hemorrhoids where you have droplets of blood. Uh, anal cancer bleeds a lot, or well, any cancer bleeds a lot. Okay, if they have their own blood supply, so any scratch or any scratch on a cancer, it can bleed a lot. It can bleed a lot. Okay, how do people get anal cancer? It can be genetic. Cancer is it can be if it runs in a family, you have a chance of getting it. It can also be from the diet. It can also be from the diet. Uh, like they say colon cancer, for example, from eating too much meat and not having enough fiber in your diet. I see so many rectal cancer cases every week. It's ridiculous. I see breast cancer patients almost every day. Okay. So yeah, cancer is not pretty. It's like the ugliest disease you could ever see. Any kind of cancer. So anal cancer, treatment for anal cancer, of course, it has to be surgery, as along with chemotherapy. So surgical treatment for anal cancer. There is one more. There is one treatment which is less less drastic, which is an excision, but that's only for low stage anal cancer, like the stage ones, the small ones. But usually these people come in with like bigger cancer, higher stage cancer. And the surgery for that is abdominal perineal resection, or they call it APR for short. APR. Uh, what they do is in this surgery, what they do is they remove they close your anus. The doctor has to close your anus, and they have to remove the anus, the tube, the anus, the rectum, and part of the sigmoid colon, maybe even the descending colon. And they remove that because the tumor would be here or the cancer would be here. They have to remove this whole thing, and they close the anus. So what happens is you have a colostomy, or the other end of the colon, the other end of the intestine, they put it out through your abdomen, and all your poop will go out through a bag. Yeah, you poop in a bag. And this kind of surgery is permanent. I mean, this kind of thing is permanent. Once you have, if you undergo this procedure, the pooping in the bag is permanent. It's for life. Like, you don't have an anus, you'll just poop here. But there are some colostomies. We call this a colostomy. Having when you have a part of your colon sticking out of your abdomen and they put a bag. It's called a colostomy. There are some colostomies that are temporary. Like they put it out, but like they will do surgery on you on a later date to put your colon back in or your bowel back in. But if it's this procedure, the abdominal perineal resection, this is permanent. But Tato my Kato? Is this Tato my Kato or Teto my Keto? Thank you for following, by the way. I don't know how to pronounce your name. I don't know how to pronounce your name. Can I donate my ass? What? Unfortunately, no. Unfortunately, no. You cannot donate your ass. I've had a colostomy bag explode on me when I was a medical intern. I think we all had that. We all had that. This when a bag breaks and just blows up on you. Oh god. You can smell the poop. But then you're a doctor, or if you're a nurse, you gotta live with it. You gotta live with it. I was about to finish internship when it happened like a few weeks ago. Oh my god. Oh god. Yeah. Alright, I think this is the last slide. Oh no, yeah, that's my last slide. That's my last slide. That's really short. So if you have any questions, I can entertain some questions if you want. You can submit your ass to Oh my god. Don't submit your asses to me. I'm not gonna do anything to them. You can keep your asses. I have my own ass. I have a pon ass, okay? I have a pon ass. Manager Dogs, hello, welcome to my stream. Let's all submit our Let's all submit our asses. What? Pana best ass. Come on. Ass. Pon ass is the better ass, okay? Pon ass is the better ass. Pon ass is better. Okay. Let me fix this. Alright. You guys have any questions? We can chat for a little bit before for anything. Unfortunately, I was supposed to play Surgeon Simulator, but I decided not to because I'm so busy. I need time. Yeah. I want to see Bread's ass with his anus. What? Why do you want to see Bread's ass? Okay, okay, for people who want to see Bread's ass, let's flash it. We're gonna flash Bread's butt right now. That's a bread butt. Bread butt. For Ray Winter. I'm gonna flash Bread's butt right now. For Ray Winter. Okay. We're gonna flash Bread's butt. Thank you for the 10 bits, Jay Aganoy. Until the next medical stream. Yeah, I'm thinking if I'll do another one this month, since I missed one last month. I don't know. It depends if I have time. Okay, wait. I still need to. I'm gonna flash Bread's butt. Do I have it here? Oh yeah, I do have it here. Okay. Here we go. Bread butt. Bread's butt right here. I actually got this from his Facebook page. Oh god. But yeah, what a beautiful ass. His bread buns. I think he's streaming right now. So he won't be able to see this. He won't be able to see this. Is Bread's ass cup B? Cup B. Mizu, thank you for the donation, $5. That will definitely go to Malvin for the charity. Thank you so much. Anus gaming. Bread. Okay, we're done looking at Bread's butt now. Okay, we're done looking at that. Oh my god. Okay. I'll donate bra for Bread's. I don't know what cup it would be. Probably a B cup. Bread. B for bread. Bread cup. I don't know. Oh god. Alright. Oh god. Okay. You guys have any questions? I can answer some questions if you have. And I think I will have another medical education stream. I'll ask you. I'll do another medical education stream. I don't know. I'll think about it. I am planning to do a subathon actually sometime before the month ends, and I'll do a medical education stream there. I just don't know what topic to cover though. Best horror stream, very educational. God, I'm glad you guys enjoyed. I'm glad you guys enjoyed. I had a breast stream before. You guys actually, how many of you saw the breast stream? I can go do that right now. We can do 2 lectures. I mean, I can re-lecture the breast. I mean, since we talked about anus, I know everyone wants to know about the breast anyway. I can do that. Wait, let me see if I have the file though. Let me see. Because it's only 10:30. I can probably do like another hour. Let's see. What? Subathon, yeah. One of the most enjoyable educations. How do I know if I should go to a specialist or a normal doctor? It depends on your Teto Maketo or Tato Maikato. It depends on your it depends. You can go to a normal doctor first and they will do initial checkup on you, and then if they feel that you need to be referred to a specialist, they will refer you to a specialist. It depends also on your problem. Like if you have for example, you have a heart problem, then you go to a cardiologist. But you know, you'll only know if you have a heart problem after some laboratory tests. You know, anus and boobs in one stream. So yeah, it really depends. You can go to a normal doctor first or a general practitioner. They will know if you need to be referred to a specialist. Let me check first if I still have the breasts. Okay, the breast slides. I don't even remember. I think breast was the second one where is it? Do I have it here? Let's see. Let me take a look, okay? Yeah, okay. Alright, yeah, I still have it here. Do you guys want to do breast? Do you want me to lecture breast? I'll do it really quick, though. Do you want me to do breast? Do you want me to re-lecture breast? The last time this was the second lecture I did. This was the second lecture I did, and, oh, wait. Wait, I need to make the censors a little more, I need to censor it a little more because I might get banned from this. There's a lot, wait. Let me put a censor on this thing. Wait. uh, okay, there we go. I have to put a bar here just in case, because I know I have to put. I'm sorry, guys. Okay, I have to put the. I have to make the sensors a lot bigger because you know Twitch is a lot stricter when it comes to stuff like this. The last time I did this lecture, it was on Facebook, so I don't think everyone saw it. This one. Hold on, guys. Okay. Let me make sure I don't. Okay. I just gotta make sure I don't I don't get banned for showing. Let me just enlarge my sensors, okay? Okay, this one, okay, this one. Alright, wait. Gotta make it bigger. Bigger sensor. Okay, I think that one. Oh, Misato, thank you for following. Okay. I'm just let me just fix this, okay? Because I don't want to get banned for I don't want to get banned for giving a medical education lecture, okay? Let's see this. Okay, this one I need to enlarge the sensor. Hold on, guys, okay? Ah! Oh my god! Enlarge your sensor. Okay. Okay. Gotta go, Doc, doing art commissions. Okay, Flappy Rory, thank you for stopping by. For science. What anime is this? I'm browsing randomly here. Anime? What anime? Hello, Sir Nix. Welcome to my stream. Let me see. Aesthetic surgery. Oh, wait. Okay. This. Oh, no. Okay, I have to make this bigger. Bigger sensor. Okay, there. Alright, I think that's okay. I think this is okay. I hope. Oh, wait. I have to get rid of this. This one. Twitch might ban me for this photo. Okay, I think that's okay. Alright! I think this is okay. I think. Twitch, I hope you don't ban me for this lecture. This is very educational. Okay, let me, How many medical education streams have you done so far? I've done, how many have I done? Let me check. 1, 2, 3, 4, 5, 6, 7. 7 actually. I've done 7 already. I've done 7. The first one I lectured was appendix, and then the second one was breast, and the third one was heart. Third one was heart. Fourth one was gallbladder, I think. I don't know if it's gallbladder or urinary system. One of those, and then burn, and then anus. I think you won't be reported or get Twitch ban as long as the stream is categorized as informative. Informative? Wait, is there a wait? Okay, let's do that. Informative. Wait. Is there like an educational? I just put on just chatting. I don't know. Should I put it on education? There's like I don't know where to put it here though. I don't know. Just chatting. Let's put it back on just chatting. Kidney stream, man. I actually talked about kidneys before. Urinary system. I did that already. I did that already though. Anyway, here we'll do breast, like really quick, okay? Let me Okay. Alright, guys, we'll do this quickly. Breast is an old lecture, okay? This is a breast lecture. So, let's just skip this slide because this slide is dangerous. Okay, anatomy of the breast. Anatomy of the breast. Hold on. Alright, anatomy. So this is the female breast, okay? So, female breast, the anatomy is the areola, the nipple, and inside you have the fatty tissues, the lobules, the lobes that have ducts. The lobes are the ones that produce milk, okay? They're the ones who produce milk, and they expel it through the nipple. Right. There's also a bunch of lymph nodes that come from the breast, and they go to the axilla or the armpit. Okay. All right. That's all you need to know. And underneath the breast is the muscle, the pectoralis major and pectoralis minor. And yeah, men do have breasts. Okay. So this is a chest of a man, and this is his breast. Yeah, basically, it's just they have the same anatomy, except that men's breasts don't have the lobules. They have ducts, but they don't have lobes or lobules. Okay, they can't produce milk. Okay, so yeah, this for all the men out there. This is the anatomy of your chest. Okay. Is there any way to make the men's breast smaller? Surgery is the way, or take hormone, or take testosterone, or something. All right. Okay, let's go. Next slide. So, small versus big breasts. Small versus big. You know, you can either go for plot or you can go for flat. It doesn't matter. The breasts have the same purpose. There's no better breast. It's all subjective. If someone likes the bigger ones, you can go for the bigger ones. Or if you want a small one, you can go small. You can go for a board if you want. It doesn't matter. They serve the same purpose. Okay. Alright. Alright, next. Purpose of the breast. Smaller breasts are a faster way to women's whatever meal twister. Does size affect milk production? No, it does not, because when a woman gets pregnant and she starts producing milk, the breast gets bigger because the glands, the lobes get engorged in milk, so it doesn't really matter. The size of the breast size is dependent on the fat that is distributed in the breast. It's not really the lobes. The reason a woman's breast is big is because of the fat distribution. Cali breast. Alright. Alright, next. So, purpose of the breast, yeah. It's to produce milk. It's a gland. A breast is a gland. It's a mammary gland. You produce milk for young babies. And another purpose of the breast, there is actually another purpose, and it's erogenous. It's an erogenous purpose. So yeah, you know how you can touch breasts and it turns people on. Yeah, erogenous. And we're gonna skip this slide now. We're gonna skip that slide. Okay, let me look at the questions. The smaller the chest, the closer to your eye. Chiwa Night Feather, hello, welcome to my medical education. Oh wait, I forgot to change this to breast. It's still an anus. Let's put it on breast though. Let's put it on breast. Breast. I forgot to change this. Breast. Okay. We are now on breast. We are now on breast. Okay. Shiori is a Fujoshi. I'm not. I just actually looked it up on Google just to search for that. Alright. Can breasts get pimples? Yeah. But very rarely, not like on the face. Because, breast is covered by skin, right? The pimples are a skin lesion, so anywhere in the skin you can get, pimples. Depends on the sweat glands and the oil glands. But yeah, breasts can get pimples. Self-breast examination. So to the women out there, you need to do this every month. You gotta do this every month. So here's how you examine your breast, okay? You can do it standing or lying down. All you gotta do is raise one arm up and just palpate. Just feel your breast for any masses. Yeah, you can do it circularly, or you can do it in out, or you can do it downwards up. As long as you palpate or you feel the breast. This is how you'll know if you have a mass or a bukol in your breast. A mass. Okay. Very important for women especially. It should be done monthly, especially when you're of reproductive age. Uh, all right, next. Okay, diseases. Diseases of the breast. All right, one is mastitis, or the infection of the breast, or inflammation of the breast, especially on the lobes. This is usually seen in women who breastfeed. This is usually seen in women who breastfeed because of the baby when they suck on the breast. They can cause small injuries and it could get infected, and yeah, you can get pus in the breast. It's nasty. It's really bad. This thing is painful. You would notice the breast is red, swollen, and there's pus. What if we've never done it before? Something bad's gonna happen. Self what's this? Examining your breast. Uh, the reason why I say women have to do this every month is because you want to make sure you don't have masses in your breast. Because any mass in the breast is already considered suspicious for breast cancer. You gotta get that biopsied. So that's the reason why you have to palpate or feel the breast. You gotta make sure you don't have any masses there. Okay. All right. So yeah, this is a mastitis. Inflammation or infection of the breast. It is treated by antibiotics if it's small. If the infection is controlled or small, it can the what do you call this? The pus can just be reabsorbed or disappear. Or you can do surgery. Surgery where you have to cut the area of the breast that is most fluctuant or has the pus, and you have to drain it out. So yeah. Okay. What is H1N1? Is H1N1 is one of the breast disease? But H1N1, isn't that like an influenza? Is that flu? What do you mean by H1N1? As I know H1N1 as like flu, or wait, swine flu. It's not really a disease, it's a virus. H1N1 is a virus. It's a flu. Anyway, okay, moving on. So next is breast mass, or this is the one I said you have to feel your breast. You have to feel for masses. You got different kinds of, if you say benign, there's two different types of breast mass. You got the benign and the malignant. Benign is the non-cancerous breast mass, okay? This is non-cancerous. This is the better, quote unquote, better breast mass. If you would have a breast mass, you'd want it to be benign. You don't want it to be malignant. So benign, you can have fibrocystic changes. This is common when women have their period. Like if you're about to get your period, if you feel your breast, you'll feel like lumpy. It'll feel lumpy and painful. That's fibrocystic changes. Like you'd have little cysts around your breast, but they disappear after your period. Next one is fibroadenoma, which is a solid mass. This one needs to be biopsied. Like if you palpate your breast, if you feel your breast and you feel a solid mass, it has to be biopsied. You can do a core needle biopsy. The usual biopsy done in surgery is a needle, core needle biopsy. They poke your breast with a needle, get a sample, and then send it for biopsy. Another option is cutting open the breast and taking the entire mass out. But the gold standard is a core needle biopsy. Okay. Malignant is cancer. Malignant breast mass is cancer, basically. So you got different stages. Stages depend on the size of the breast mass and and metastasis, or the scatter of the breast mass to the lymph nodes or in other areas of the body. So if you're if the breast mass or if the cancer spreads to the brain or the bone or the lung or the liver, it's a stage 4 cancer. These things need chemotherapy. Okay? So treatment. Here we go. Oh, here, biopsy procedures. So, there's a fine needle aspiration biopsy, which is a small needle. It's not usually done. The one usually done is a core biopsy, which is a larger needle, and then they get a sample of the tumor and then send it into for histopathology to see if it's benign or malignant. Others are, like I said, excision biopsy, where you open the breast, get the mass, and then close it. Okay. What else? Now, if you have a cancer, you have to. There are different ways to treat this. Most commonly is the modified radical mastectomy, or removal of the entire breast with the lymph nodes in the armpit or the axilla. So yeah, according to psychology question, is force too much on breast stress can make bad effect. What do you mean by force too much on breast? What do you mean by that? Like if you hit it? Any trauma to the breast is bad. Any trauma to the breast is bad. Yeah, of course. If you hit a breast, it can bleed inside. It's a trauma. So you can have a hematoma, or it can turn into it can lead to a breast mass. Yeah. So yeah, the other ways of treating breast cancer is there's a thing called breast conservation therapy. So instead of removing the whole breast, what they do is they remove they cut the breast and then remove the mass, and then and then they look in the axilla or in the armpit for the first lymph node that has a cancer cells. It's called a sentinel lymph node biopsy. And then they get that, and then that's it. The woman doesn't have to lose her breast. That one's actually better in terms of psych psychiatric, for the woman, because a woman who loses one of her breasts, they get depressed after a while, especially if they're young. Okay, I can be psychologic VTuber, but I'm not a VTuber. Okay. Next is chemotherapy. Yeah, after cancer, all cancers need chemotherapy. Okay, you can't just do surgery and not go through chemotherapy. That's bad. That's bad. You have to go through chemotherapy. Unfortunately, I see a lot of patients who are scared of chemotherapy because of all the stories that are told to them, like losing hair and all that. Like, if you need it, you need it. If you need it, you need it. Chemotherapy has a side effect of you losing your hair, but that's what's wrong with losing your hair, really? It will grow back when you're done with your chemotherapy. Okay, and another thing, herbal medications. Okay, a lot of people, I have a lot of patients who have breast cancer. They go to a doctor and they're offered chemotherapy, but they don't want to have chemotherapy. So what they do is they go to an arbolario or a shaman, and they're given all these concoctions or herbal meds. Now, herbal medications, they're okay, but you shouldn't rely on them or think that they're the cure. They're good as a supplement, but you still need to have your chemotherapy. So yeah, I've had a lot of patients who relied on herbal meds. They come first, their cancer is like small. They go through herbal medications, and like a few months later they're in the emergency room having difficulty breathing, and their breast mass is like ruptured. It ate up the entire breast. Okay, the cancer ate up the entire breast, and really breast cancer that's like that, it's bad. It smells, it bleeds, and there's pus everywhere. It's really bad. It's not nice to look at. These patients usually pass away after like a few days because they'd be stage 4. They'd be stage 4. Also, one of my main questions: squishing breasts make breast getting big? I, that question was asked to me before. I have never heard about that. I mean, I don't know if that's accurate, but I don't think it is. It's not accurate. People believe that if you massage the breast, it'll get bigger. But no. No, it's not. I not have breast cancer, but I won't cut my hair. Alright, so herbal medications, only supplement, okay? Only supplement. Don't rely on it. Okay, aesthetic surgery. I'll go through this really briefly. So, there are some patients or girls who want to have bigger breasts or smaller breasts, but usually it's the bigger breasts. Breast augmentation is placing an implant. The implant is made out of silicone. Uchiha 420, thank you for following. So, it's surgery where they make an incision under the breast and then put a silicone just to make the breast larger. That's basically it. And there's also breast reduction. So what they do is they incise the breast and remove a part. Remove, like, it's like a wedge resection, or they remove a part to make it smaller. Yeah, just like this. This is the incision. Okay. I love flat and why I'm normal. Yeah, so yeah, this is it. I have not seen a breast reduction before, but I have seen a breast augmentation, and it's fun actually. It's fun to see. Plastic surgery is fun. And yeah, that's the end of the breast lecture. Really quickly. Really quick. Kara Noriante, hello, welcome to my stream. Oh, my stream, yeah. A while ago it was anus. A while ago it was anus. So yeah, I'm done with that. We got 2 lectures done. Okay. Wait. Shiori Pun is the cutest when she's a doctor. Ah, thank you, thank you. Thank you so much. Educational advice. Yeah, so okay, guys, you had anus and breasts. I hope Twitch doesn't ban me. This was educational. This is very educational. I mean, your other avatar is cute, but you're cutest with this one. Ah, thank you. Thank you so much. Alright, it's 11. I think I can end my stream. I hope you guys enjoyed. I hope you guys enjoyed this and you learned a lot. Alright. As for this, the VOD for this stream, I will download the VOD for this stream and I will archive it on YouTube, okay? I want to make sure Twitch doesn't ban me for this. Even though it's what you call this, educational, but I know Twitch is very strict when it comes to nudity and all that. So I'm gonna download this and I'll re-upload it on YouTube. Okay. FAAC Gaming, hello. I'm actually almost done. I want to ask question out of topic. According to allergy, what effect on allergy? Huh? What do you mean by effect on allergy? I don't understand your question. Is there any NSFW for this avatar? I have fan art and I have some art. I have some NSFW art on my avatar. It's on Twitter. You can just check Shiori's Shiori porn. But not all of it's there though. I don't think people use the hashtags. Oh, YouTube, I see. Yeah, I will upload this on YouTube. All the lecture streams I will upload to YouTube. I did Doc Loki terrified at disease. Thanks for the unique and informative stream. Did you show any nudity on stream? No, I made sure that the sensitive parts are censored. Censored by Sir Wheatbread. I had to make sure they were actually heavily censored, to be honest. But I just want to be doubly sure. Effect after eating some allergic food. What? Oh, if you have allergies, is that what you mean? Usually, allergies are usually like if you have rashes or swelling, or even worse when you have difficulty breathing. That's the worst one, is when you have difficulty breathing. Like especially when eating something, you can have like swelling on the throat and you can't breathe. That one's bad. That's actually bad. Thank you for following, Chiwa Night Feather. You were asking me where I was from. I'm from the Philippines. I'm from the Philippines. Oh, also 11 p.m. too. Yeah, I'm from the Philippines. Southeast Asia country. Let's raid anyway. Yeah, let's raid someone. We can. I can end the stream now. I have. Oh, you're from Malaysia. Okay. Hello from the Philippines. Okay, let's raid someone. My next stream will be tomorrow. Oh wait, is it? Yeah, tomorrow. I'll be playing Cyberpunk 2077. Okay. I'll be playing Cyberpunk 2077, and after tomorrow, my next stream will be March 19. I will be playing I Am Bread. Let me show you my let me show you the schedule again. Hold on. It's a let me put up my let me bring up my schedule so that you guys can wait. Hold on, guys. Hold on, guys. Okay. Where is it? Okay, here we go. All right. Yeah. So next stream is tomorrow. I'll do Cyberpunk 2077, and then on Friday. Wait, is it Friday? On on March 19, I'll be playing I Am Bread. I'll be playing I Am Bread. I'm gonna see what it's like to live the life of a slice of bread. We'll be playing that, and actually, I have another stream on Saturday, which will be a collab. I will announce it tomorrow. Hopefully, I don't get stuck in the operating room again on surgery before the collab, because that's gonna be very bad. Hopefully not though. Alright, so yeah, that's my stream schedule. Okay. Let's raid someone. Let's raid someone. Let's see. Let's read another VTuber. Sir Wheatbread is playing Bravely Default right now. Well, you might as well raid Sir Wheatbread, right? Or wait, let's wait. We can raid. Huh. Bread's. You want me to raid Bread? I think Bread. Okay, let's raid Bread. Since I've been using Wheatbread heavily for sensors. As a sensor. Okay, guys, just say Pon Raid. Just say Pon Raid, you guys, okay? Sir Wheatbread. Pon ass raid. Just say Pon Raid, and yeah, I'll see you guys tomorrow, okay? Let's go. We'll raid Sir Wheatbread in a while, so everyone, bye-bye. Goodbye, everyone. Good night. I'll see you tomorrow. Bye-bye. Bye-bye.